Hello everyone, my name is Fallon Barnes. The healthcare professional that I have chose is radiologist. With that being said, radiologists do pose to have issues with not transgenders yourself, but as far as reading those images, it can create an issue. As far as like, did detect or get the right patient, and so patient discrepancies is the main issue. With that being said, sex refers to the biological attributes of humans, such as like genitalias, and genetic appearances. Gender refers to the behaviors, expressions, which a person can identify as. So, which means if a person is born a male and they feel as they identify more with females, then their gender would be female, and they essentially would be called transgender. With that being said, there is some challenges in healthcare with not transgender themselves, but with the biological aspect of it, especially with radiologists, as far as reading their images and having to dictate what they're looking at. So they're not reading and thinking that, hey, this is a pelvic mass, but it can really be a prostate mass, because instead of the person identifies as a female, but their sex was a male when they were born. With that being said, it's crucial to still give adequate care to transgenders, no matter what. And with radiologists, it's important that they still, as well as radiologic technologists, you still respect your patients. You still treat them as you want to be treated, or as your family want to be treated. You treat them as no less. You respect their wishes. You respect what they identify themselves as. And if that's the case, then that's fine. Like, you just respect what they want. And most of the time, it'll be in your EHR system what that person will identify as in their gender assignment role. So it'll tell you. And one thing with radiologists and radiologic technologists, they have to dictate and make sure you put in your notes, hey, this patient is previously transgender, whether they either went the transgender and had that surgery, or if not. So that way your radiologist does not read it and see, hey, this is a male patient, or this is a female patient, but they have male body parts. So they don't think that you did the wrong patient or any discrepancies like that. So you never want to ask those patients if, really if they had any surgeries like that. It's always in their history, and because you want to be respectful, and they're not going to take it as that, and as well as, that's them. That's what makes them them, which is perfectly fine. You don't put, so the risk factor, another thing is, it can be a misread on a diagnosis. If the radiologist isn't thinking that, hey, let's just say this patient has a prostate mass, and the radiologist reads it as something else, and it's unseen, and this patient dies because of cancer because of it. That's a definite issue. That's why you always want to chart everything in that patient's history and make sure that you inform your doctors and the techs as well. If you do have to ask questions, make sure they're respectful. They are not there's a fine line between disrespect and respectful. So just do not go over that, and always make sure no negative, nothing, new approaches. There is training. There's modules that our organization many organizations as well offer how to handle situations like this, and what's the best things to say without, not intentionally trying to disrespect your patient, but finding good ways to ask questions that you may need to know. It's very, very important that we always ask questions, because you never know in the healthcare field what may be going on with that patient. Even as well as that's one big issue with it being read wrong, and that way the radiologist doesn't have to do an addendum and create more work and more confusion. And you also don't want there's procedures that, let's just say, one procedure, there's different procedures that you do within medical imaging, and they are sex-based as far as how you approach it. So, you always want to, if you have to ask that question, or try to, just be respectful, or look in the chart. It's in the chart. Explain everything you have to do to the patient, every little detail. Also, it's like I said, it's always good to do training. It's always good. There's for the hospital that you may work at, to always look at their clinical processes, and if they need to change it, then change it, and go about it the right way. And as far as that's it. Thank you, and have a great day.